Um, you know, in the narcissistic wound for children is that they're vulnerable. And vulnerability is dangerous unless there is safe, secure attachment. And I think that's the narcissistic wound. In some clients, you see very big fight and flight parts guarding the parts that have been wounded. I don't know why we call it a narcissistic wound, because in fact, what it is it's a wound to very small children that then becomes defended by very, very vigorous fight and flight parts. And I think actually, I think narcissistic parents are very frightening parents often. The emptiness I see as either the emptiness of a submit part feeling like a nothing, or the emptiness of an attached part, because attached parts need connection, just like all little kids, right? Little kids need connection. And so I help clients work with developing a non-vulnerable connection to their fight and flight parts. We make a mistake as therapists. We go straight for the vulnerability. That's simply going to be threatening to most trauma survivors. So I say, let's go first to validating the fight and flight part's defense of that wounded child. And let's not call it a narcissistic wound. It's not a wound to pride. It's a wound to the heart. That's really what it is. And I just want to say, I know there are many of you on this call who are trauma survivors yourself. And what I can say is that, the trauma world just started developing at the very end of the 80s. We're still a young field. We're catching up. We're getting better and better, and have hope because we are finding ways to understand trauma and to offer help more and more.